And here is your question. Right, so if you have read and understood, kindly tell me, how would you address the issue of this patient?
I will talk with the patients or his attendant that this is a metastatic carcinoma, and there is the involvement of the lymph nodes, and there is it can be recurrent, and there is it needs treatment like chemotherapy.
Okay, patient had COPD and then patient was diagnosed with small cell lung carcinoma. What are the most common carcinomas of lung that can occur?
Common carcinoma is the adenocarcinoma
Of lungs?
Of lung. Sorry, ma'am. It's squamous cell carcinoma. Squamous cell carcinoma.
What is the mode of spread of small cell lung carcinoma?
Squamous cell carcinoma usually spread. It is centrally located, and it is usually lymph node spread. It spreads to lymph nodes.
Which one are you talking about? Small cell lung carcinoma, lung cancer?
Ma'am, I'm talking about squamous cell.
Yes, but I asked you about small cell. Okay, can you please tell me what is the pathogenesis behind small cell lung carcinoma which this patient had? Pathogenesis, can you tell me?
Pathogenesis small cell lung cancer, ma'am.
Yes, please. Okay, can you tell me what are the options available to confirm your diagnosis?
Okay, ma'am. For diagnosis, at first we will do normal CBC, then with ESR, then chest X-ray, then bronchoscopy, and to see the metastasis, we'll do CT scan, and to see the metastasis, we'll do the MRI.
Okay, can you please tell me how would you differentiate between mesothelioma and bronchogenic carcinoma?
Okay, mesothelioma is epithelial origin, and the bronchogenic carcinoma which occurs in the bronchus tissue, and mesothelioma is treating mesothelioma in surgical treatment is not possible, but in bronchogenic carcinoma we can choose an option for surgery like pneumonectomy or bronchogenic biopsy, and mesothelioma spreads aggressively, where bronchogenic carcinoma spreads relatively less aggressive than mesothelioma.
Okay, in this patient, histology report says carcinoid tumor invading pleura and lymph nodes. What does that mean?
That means this is the signs of aggressiveness of the cancer, because it's already invading pleura, and lymph nodes involvement.
What are the different ways to classify lung carcinomas?
There are two ways. One is small cell lung cancer, another is non-small cell lung cancer. Small cell lung cancer is pure small cell, mixed small cell. In case of non-small cell, there is squamous cell carcinoma, large cell carcinoma, adenocarcinoma, adenosquamous carcinoma, and carcinoid tumor.
And then adenocarcinoma, which can be classic or bronchoalveolar. Can you tell me what is adenocarcinoma?
Adenocarcinoma, ma'am, is cancer that forms in the mucus secreting glands throughout the body.
Can you give examples? What are these glands producing?
These glands produce, ma'am, mucus.
Are there any tumor markers related with the lung carcinoma? Can lung carcinoma
It can
be hereditary?
They secrete, ma'am, in case of squamous cell carcinoma, they secrete parathyroid hormone related hormone, and our cell carcinoma, it secreted adenocorticotrophic hormone.
Okay, can you mention few risk factors which cause or contribute to lung carcinoma and can be avoided?
Okay, like smoking is one of the cause. Then aged more than 60 years, and then some symptoms like Cushing syndrome, hypercalcemia,
risk factors like smoking, okay. Then radiation, maybe
radiation,
working conditions like
Mm.
asbestosis, etc., mesothelioma, etc.
Yes,
That
ma'am.
occurs because of, and then any gene that you can tell me. Okay.
Gene, yeah.
What should be the treatment of carcinoma, lung carcinoma? In this case, for example,
small cell lung cancer is easily chemosensitive, so we can give chemo radiation, then we will go for surgery if possible.
How should the pathology of flera be managed? Pleural pathology.
A pleural, it will give chem. Are you talking about a chemotherapeutic agent like tyrosine kinase inhibitor?
I'm asking you, how would you manage a patient like just post this one, which has pleural pathology as well? How would you? What are the treatment options for him?
These patients in the scenario that is described is already, ma'am, as it is metastasis, so we will not go for surgery. So there will be palliative treatment, and it should be chemotherapy. At first we will do the immunohistochemistry. If the tumor was epidermal growth factor positive, then we will choose some chemotherapeutic agent like tyrosine kinase inhibitor, like imatinib.
Okay, if just suppose you yourself is saying this patient has advanced carcinoma, it is poorly differentiated, how would you tell the epithelial origin? Is it possible to tell the epithelial origin of the carcinoma?
Yes, ma'am, by doing immunohistochemistry like FISH technique.
Okay. Right, thanks.